I agree with the speakers with Robert's point of the potential is enormous, and we have to be judicious as we're developing a regulatory scheme so that we don't unnecessarily limit ourselves and limit the benefits that we get from it. What's happening over here, first of all, in the United States, as you can see, you've had coverage of our recent election. We have a fundamental tension from when we were created between those who want a larger government role and those who want a smaller government role. And we're split about 50-50. And so that makes it more challenging to do something at a national level when there's not a substantial majority of support. In addition, we have a federal system where there is a huge amount of operational autonomy given to individual states to set rules and regulations. And then we've been in a process of commercial consolidation where there aren't individual physician offices or individual hospitals anymore. They're conglomerated into systems. And the challenge that poses to an approach, and that's why my comments earlier on is that at least where we sit in the United States, what's really important is every user organization needs to have a process for considering questions about the ethical use of AI. In some cases, they'll be able to accept work that has been done at a different level. In other cases, their particular use may require some local considerations. And what I think is most important is in the education, not only of professionals in training, but professionals in practice, making them aware that because AI can do some fantastic things and can do it faster than we can individually, that we still often don't understand all those risk factors. It's not explainable why it's doing, and they need to be aware of that. Some instances it'll have practical implications, in some instances it won't. But I think that there's a tendency, as more and more apps of all sorts have gotten onto our phones and into our system, that you just trust the app. And healthcare is an enterprise where sometimes we can trust the app, but we can trust it even more if we know there's been a rigorous review at some level. And so I think the challenge is that we're not going to be able to centrally mandate the use of these requirements. But we, on the other hand, need to educate people that these are dimensions that need to be considered in their particular setting, and just continually pound on people literally to say AI isn't a given. It's something that can be positive, but it can't just be accepted. And there's lots of guidelines out there, and I'm not convinced that it makes a lot of difference which set of requirements you use, as long as you use some, because they all raise issues about human agency, explainability, and so on. And so, again, the point being that we need to increase awareness of the risk, which is the framework the European Union set. And I think that's an excellent model for the US. Our challenge is we're not going to be able to do that at a high level. We're going to have to do that at multiple levels.
Can I jump in here,
please,
Raja?
Wendy.
No, because Don, you just mentioned apps, and that was something I didn't have time to go into when we were talking about the privacy issues. You know, people don't realize that when they download an app, and I'm talking specifically for some skin cancer apps, you know, where you take images and then it records it, and then it tells you that whether there's been a change in your mole, and then whether you should go to a doctor or not. So people don't realize that when you, at the very beginning, when you click on the app, you know, you have the agreements. I agree to this. Nobody reads that. But in fact, what they're doing is they're giving the rights to the company who owns the app to use that data and to sell it onto third parties. So I think, you know, people need to be aware if their data is going to be outsourced, it's going to be sold to other countries even. So, you know, people around the world, we're talking now about the global perspective, because Don, you're giving the US perspective, but and Europe has been criticized for being a bit behind, right? Behind the US and behind China in terms of AI. But I think we're very advanced in providing the guidelines and making sure that we have the security and the safety. Because why is it that China is so advanced? It's because there's no data privacy, right? I mean, everyone just has to give up their data and information, and this is why they were able to contain COVID, for example. People didn't have the choice. You had to download an app. You have, it's part of your phone, and if your phone says red, then you're not allowed to buy something from the supermarket or whatever. You don't have a choice in saying that. So, you need a balance. How do you then balance personal privacy versus, the advance of the greater good? So I think this is something that we really need to be careful of when Europe is being criticized for being so behind in terms of AI and not having enough data out there. And then just want to finish with, what we didn't cover is the fake news part. 5G and cancer. I get so many emails about 5G, causing cancer that, you just can't look at it anymore. But there are people out there who's convinced that 5G is going to cause cancer. And so therefore they don't want 5G. They don't want any more advances in technology. And I think this is where it's very important to really provide AI/health literacy for the general population and also for healthcare professionals.
Absolutely. Actually, the apps is really an important point, because you have apps indeed, for example, for skin cancer detection, and you have the tracing apps for COVID, which mostly don't use AI systems, but the deployment of all these apps have shown different approaches to values, actually. So very recently, there was a paper in the MIT Technology Review comparing apps across countries, and in terms of transparency, in terms of adoption, etc. And not surprisingly, the apps that were developed and used in Europe have all the stars, and in terms of respecting human agency and transparency, etc. So what I want to say across this is that the development of these apps and their adoption has raised a lot of debates. Probably no other app in any domain has led to such a public debate. And now, of course, people don't understand necessarily, I mean, the layman doesn't understand necessarily how they are working, but this public debate and these opinions that have been provided about the apps, I think were very useful so that people can understand what's going on, and some fake news about the apps and about the COVID itself can be also addressed through this channel, which leads me to say that the more actually you have transparency and the more you have openness about what the systems are doing, how they have been designed, what are the values that are respected by those systems, and involve people and involve the specialists. And this is an example, again, about the engineering competence with the healthcare, with the general public and ethics committees as well, lead to, I believe, a better policy. Not always easy, especially in a crisis situation, but it might be an example to learn some lessons about how we explain, how we deploy, how we discuss those systems at maybe not at the same level or at the same dimension, but I think lessons can be drawn from this.
It'd be interesting to hear Danny reflect for just a minute, because he's working with industry to innovate. This discussion that we've been having, are you seeing as an industry promoter sorts of dialogue between users and industry around these sorts of issues?
Yes, and it's also very necessary, as what was highlighted earlier before. And I don't want to go into the details, for instance, on the contact tracing apps, but I think there's a valuable lesson to learn because we had quite some public debate around these tracing apps, and certainly from a European perspective, these apps have been rigorously vetted when it comes to data protection and privacy. And even still, we see that overall, the numbers of these apps that have been downloaded are still rather low. So if we take this more from an AI angle, yes, trust is very important, but explainability or transparency is only a part of it. It's not the silver bullet that will solve everything. It's a part of the puzzle. And we need to convince people. I think that's the right word. Convince people, bring them in, bring in patients, bring in healthcare professionals so that they better understand how it works. Coming back to one of the first things that Wendy said, when you Google AI, and it's like your usual bingo card on AI or data. Data is the new oil. Will there be killer robots, and will AI replace the nurse, the doctor, and what have you? I think people have all these projections and imaginations about what AI can do, but we need to be realistic. I mean, we now see deployment of very narrow AI applications that are being integrated in a very complex ecosystem. They need to be integrated to the clinical workflow, which means that you need to train the professionals how to work with it. And coming from industry, I mean, we have some of the most advanced companies as our members, and for them, AI is a tool. It's something to assist the healthcare professional, and we don't see it as for instance, we have been building a kind of library of AI use cases of our members, where you can find an overview of some of the applications that are already in use today. And so far, all of them have been decision support systems. They help to lighten the workload for the physician by prioritizing or highlighting the more abnormal cases, which was also something that Robert indicated, for instance, in the triage setting, where you can do some kind of pre-triage and then make sure that people are fitted in at the right time, at the right flow. So I think we should be very realistic about this. And also for me, I see all these articles about AI and that they're promising the future and all this potential, and we might get there somewhere, but we should be very realistic about the current level of uptake and success when it comes to AI. And that's why trust is easily lost, and it's very critical that we ensure that we involve all different stakeholders from the healthcare setting and also the general public, so that they better understand how things work, how it is being applied and used, and how it benefits them. And of course, we also need to address discussions around the risks. And there we feel that the regulatory framework for medical devices in particular is quite well suited, although in view of the development of technology, changes may be needed, for instance, when it comes to continuous learning systems. But we need to have that dialogue to ensure that we grow the trust and we maintain the trust. Thank you.
Yes, that's really key, and the one issue that is important here is education. I mean, the fact that people come to trust something is that because they are informed correctly about what it can or cannot do. So it's not a belief. It shouldn't be a belief or something which is based on opinions. It should be based on concrete knowledge, which is grounded in science and in empirical results. So this is why education at all levels is really key here. And this leads me to, maybe we have a few minutes left, Eugenio, who is also a roboticist, not just only working on AI. And we didn't speak much about robots and wearables and physical devices. Maybe you can also give us some hints or some opinion about this side of the AI systems.
Yes, Raj, it's a pleasure to, for sure, we had this perception of having a lot of potential case studies to be investigated, also in the discussion in our group. Then we focused on these two key case studies that were included in the document. But for sure, this scenario where we have artificial intelligence enabling diffusion of intelligence in different type of technology-driven innovation for electronic health, mobile health, and automated health, where robotics is a key factor, is an emerging issue. The soft level of automation could be related to soft spots, supporting, managing health and care. So all the procedures, not just administrative, but also clinical procedure, which really need, as we say, they need to reduce the potential risk of burnout for healthcare professionals that need to really process a lot of data in the right way. But also the scenarios Wendy was mentioning about the radiomics and use of integrated data for pathomics, genomics, phenomics, exposomics, for all the assisted diagnosis for cancer and other type of diseases, including COVID-19 diseases, as you mentioned, is another very challenging issue where e-health is going to evolve. Wearable devices, for sure there would be at least three type of application areas. One is monitoring patients after the acute phase for post-acute treatments, or also age-related diseases. Here you see an example how we need to guarantee validity, reliability of data, mainly based on patient compliance, when we can use wearable systems to monitor physiological, pathological situations, but we need to reduce the amount of data to be stored and be sure to extract the key features that can generate alerts on possible cardiological or post-stroke situations, whatever type of pathologies that should be prevented also as recurring situations. So just a monitoring issue as the first level, but you can have also additional system. I'm referring to some activities of some of our spin-off companies here at Campus Biomedico University in Rome, but there are a lot of applications. In this case, you can combine monitoring with also assisted autonomous drug delivery. So using a wearable system to deliver a therapy which can minimize the possibility of having fluctuations in motor cognitive abilities, for example, in neurodegenerative disease like Parkinson's disease. So you can have the possibility to use AI-based algorithms to, for example, monitoring even facial expression and smiling, which could be a symptom of motor fluctuation, and should generate an alert or even an autonomous administration of drug therapy for different type of patients. And even for generating in this COVID period accurate management of emerging situation for people at home, patients with pulmonary diseases at home, could be supported by a number of wearable and related apps which can allow to avoid even transfer transferring patients to the hospitals when it's not really needed. And then, as you were mentioning, robotics. Of course, intelligent robotic systems are more and more diffused in hospital, in clinical conditions, from the pharmacy to radiotherapy to surgical procedures to rehabilitation, even at home. You see, in this period of COVID, many patients have been delivered a rehabilitation system at home in order to be compliant with a clinical procedure after a stroke event or whatever type of motor rehabilitation needs. So there is a lot of challenges which are being tackled, including managing of COVID center. Here you see robotic system enabled by AI algorithms and supervision system in order to reduce risks for healthcare operators to access the red zone of COVID center just to transfer biological samples rather than sanification of environments whenever a patient is moved from one area to another. So robotics could be a very challenging opening situation. And I just conclude with two key messages. On one hand, AI market is considered the one of the most relevant area of growth, of economic growth of this type of technology-driven innovation and new market sector. You see that the numbers are really impressive in terms of expected growth in the coming years by relevant reports in this field. And even robotic systems seems to be on the top of this contribution to the growth of the market. So intelligent with the physical, with an embodied nature could be really relevant. And the other key messages about affordability. We have thresholds of affordability which are related to gross domestic product per capita in each country. So we do hope technologies can enable this type of affordability more and more, and this should be a big challenge for that. And we need to educate. Here you see example in the Netherlands, in Italy. We just launched also not just double degree or engineers which can treat patients, physicians who are also clinical engineers. We are launching a national program on artificial intelligence open to the European level, together with other Italian University, National Research Council, which has a big pillar on AI for health and life science as one of the very top focused areas. So there is a lot of multidisciplinary training and new educational paths which are needed for the future of medicine. And overall, we need to be able to governing the impact of innovation. As we mentioned in the introduction of our sector, we are waiting now for intelligent vehicles, we have intelligent cars, but so far the way this type of automotive technology has been governed is not very effective. We have more than 1 million people dead per year and 3% of the gross domestic product. So this type of challenge is the key issue for the new educated professionals, which we hope will be more and more sensitive also to educate patients in order to be compliant with the right use of technology in a trustworthy, human-centered approach, as emphasized in our document.
Thank you, Eugenio. This is an excellent conclusion, actually, with a great summarizing of the work. And I think you have also given this aspect about physical devices and connectivity, which opens a whole actually reflection. So I would like to thank all the panelists for their participation and the insights that they have given to us. I would like to thank the attendees, and it's now time to close our session. The next session is starting at 11. So thank you very much all, and have a nice day with AI4People, other domains. Goodbye. Thank you.